Good afternoon. So, a couple of years ago, I did a series called Myths of the American Mind, and one of the subjects that I covered was scientism. And I thought this would be a good time to revisit some of the themes of scientism because I think we're seeing them writ large in the sort of cultural response to the pandemic. And so, this is sort of the topic on everyone's mind, I imagine, amongst others these days. And so, I just thought it would be worth sort of revisiting that, and so we can understand how science, public policy, and philosophy sort of intersect in this crazy world of ours, and to sort of understand why some things are just, many of the policies that we're seeing are not necessarily coming from science as much as they're coming from scientism, and why that's actually both predictable and sort of hard to avoid, really. So first, the difference between science, which is basically it's a method of thinking and research, and it's all this great. So it's science, yay, pro science. The problem with science is science tells us an incredible amount about almost nothing. This is the key thing to understand with science: is it on first examination, it's an incredibly powerful and helpful tool, and has made, helped underpin many revolutions in human existence, technology, and all of these things. But in practice, and certainly in practice, when you're looking at something like the pandemic we're facing, it's incredibly limited. But what happens is, because of the power of science and because of the cultural capital that science and scientific ideas have, we tend to try and take the gloss of science and apply it in places where it just does not apply. And so one thing that we've been facing for the entire time of the pandemic, as I mentioned in an earlier pandemic episode, is we are awash in unknowns. There are so many unknowns that you can't draw. Any reasonable scientific research paper would just have to list, okay, so we don't know this, we don't know this, we don't know this. Here's a hypothesis. Here's the evidence. Here's how we're organizing it. And there'd be so many caveats, which is basically one of the key features that you find in scientific research, is this pile of caveats. Like, well, we don't know this. This is the limits. This is the range of probability. Here's our accuracy. It's very fulfilling. And in some ways, if you're really looking for, clarity, we think of science as this land of clarity, but particularly cutting edge research is a land of trying to find clarity. Scientific research is all about, hey, we don't know, let's try and find some clarity. That's what they're doing. And so, as we went into the pandemic, the models, again, these are models based on sort of best guesses about what is known about a developing situation. So all of this is not helpful. Predicted, quote unquote predicted, speculated that perhaps there might be as many in the United States, that we're facing something like 2 million deaths. And then they said million deaths would be best case scenario. And so politicians and our elected representatives and medical community, everybody starts responding to this. Now, this is not a criticism of that, by the way. It's probably what the models were saying. But these were models based on assumptions, based on limited data sets, based in, trying to get real-time feel of what's going on. Now, fortunately, those models turned out to be wildly inaccurate. So, we haven't faced a million deaths, which they said was the best case scenario. We're, just over 100,000, which is still a lot of deaths, but it's a lot better than a million in the same time. So that's one example. But the problem is, now people say, oh, the models were wrong. Well, yes, their predictions were wrong, but what this just means is the assumptions that went into the models are wrong. That could be one thing, or the models themselves could be inaccurate. So there's two different problems here. Was it the model that was flawed? But no, these are models based on, real-time data coming in. These are not research verified, right? This is the problem, right? That's the problem with science. What science would say, ideally, right, if you really wanted to do this right, you would say, great, we're going to do a controlled study, and we're going to take 3 Earth planets, and we're going to expose one population to the virus. We're going to expose one population to not the virus, a placebo virus, I guess, something like that. And then we'll have a third control planet where we're not going to do anything. And then we'll run that, and then we'll compare the results. And probably you'd really want to do that a couple of times just to make sure. but we only have one planet. And so we only get to run the experiment, as it were, one time. And so the models, which were based on other diseases and other, right? So it could be that the models are flawed, and or it could be that all of the assumptions, like the rate at which it spreads, how many, what was the death rate for those who contract it, right? All these other assumptions that have to be fed in the model. One of them or several of them could be way off. And so you have this environment where we actually don't know which was wrong, right? And could be both, probably is a mix of both, that some of the assumptions turned out to be inaccurate and some of the aspects of the model itself turn out to be inaccurate. So this is not surprising. In fact, if you polled scientists before the beginning of the pandemic and said, hey, we have these models, you're going to be in this environment, what are the chances they're going to be really right? They'd be like, yeah, you're going to have this wide range of probability of outcome. And we would be suspicious of all kinds of aspects of it. So, those unknowns then feed into an environment where you go, wow, we've got this huge gap between prediction and what's happened. By the way, the million prediction was the federal government predicted that based on social distancing. So that wasn't a prediction without doing anything. That was a prediction of doing sort of what we did, vaguely what we did as a country. So the other couple of other things that have happened that were not predicted, and we really don't know what's going on, is we don't know, for instance, the mortality, the death rate seems to be dropping quite dramatically. So all over the world, the cases are going up, in fact, actually going up pretty at an incredible rate. But at the same time, the number of people who are dying from the virus are going down at a pretty substantial rate. This is both true in the world and in the United States. If you look at the numbers in the United States, our number of coronavirus cases a day is sort of stabilized. I mean, we crushed the curve, we flattened the curve. The curve isn't going up anymore, but it's not really going down anymore, sort of trending sideways, as it were. But at the same time, and surprisingly, the number of people dying from the virus has gone down by half. So the daily death rates has fallen dramatically by about half. At the same time that the number of cases per day is roughly stable. So that's weird, right? Good weird, right? We don't want people dying. So that's it's very positive. But again, it's like, well, what do we make of that? Well, there's a number of ways you can read that. Is the virus becoming less lethal? This happens with viruses sometimes. They change and morph as time goes on. They spread more broadly if you don't kill your host. So some viruses do this. Is that the background cases were very much higher earlier, so that there were a whole lot of cases that weren't being caught earlier. And so now, like, masses of the population have been infected. And so the early deaths were a representation of just a huge population that had it, that we didn't know had it. And that now what happens is those people have recovered, and just not that many people now actually have it relative to the early numbers. We don't know that because, again, another unknown is we still don't know how many people have been exposed in the country. There's been some studies that show, it's 30 times higher than the official number of people who've been exposed. That would be a huge number. Or it's 5 to 10 times higher. A lot of people seem to be saying, it's about 5 times higher. But again, we don't know. It would be a great number to know, by the way, but we still don't know that number. So, we'll see what happens there. But what you have is a declining, which is, very positive, this rapidly declining death rate. And that's the key. So people keep talking about the exposure rate and how many people are getting it. Like, that's bad, that's bad. It's only bad if you die or get really seriously hospitalized. So fewer hospitalizations, shorter hospitalizations, and fewer deaths. At some point, if, not predicting this would happen, but it would be great, right, if it just becomes like the cold. Because, tens of millions of people get the cold, hundreds of millions, maybe 1 billion people a year get the cold, but we don't care because you almost never die from the cold. So who cares if you get the cold? If that's the trajectory, then we don't care how many people get the virus. Like everybody gets the virus for Christmas. Have the virus for Christmas, right? If it doesn't hospitalize you, make you really sick, or kill you, then who cares, right? It becomes one of the just background noise diseases that's out there in our environment that has been there and always has been there. But if you can reduce, if the mortality rate keeps falling, which hopefully it will, then, wow. And so far I haven't seen much discussion of that because I think people are afraid to to express that or build people's hopes up, or I don't know why, but that would be maybe the best possible solution. If the mortality rate keeps dropping to where it drops to a sort of background rate that's acceptable, which we'll talk about in a second, then that would be good. Another example, my personal favorite example, is we've entered the mask war stage, which is a social thing about, should you wear a mask? Should you not wear a mask? People are yelling at each other about not wearing masks or wearing masks. And, it's like it's gotten crazy, and it's taken on this sort of social tinge. And if you go to different regions or different areas that have different sort of political, cultural bents, mask wearing is either very prominent or just not prominent at all, which is interesting, right? It's like a sociological experiment. But if you go back to science versus scientism, here's the thing. Now, they say that, the science says that wearing masks help. Well, the World Health Organization is not totally convinced by that, but the CDC is sort of convinced by this. But the important thing to notice is this is not, again, what counts as science? Now, the weird thing is there's really almost no evidence for this, which is not surprising. This is where science versus scientism, right? People go, we should know this. Well, think of it the other way around. Imagine you're a researcher and you say, I want to do this research project where I have people wear random stuff from their house, old construction masks, a handkerchief, a veil from their wedding, whatever it is that people are wearing out there. And I want to see if this will slow the progress of a plague, right? Of a flu or something. This is not going to be funded for about 50 reasons. One, it's crazy. Or the people aren't wearing them right. They're not cleaning them appropriately. The materials, like, why would you do this? You can't expose people to a disease and then to run a random test about wearing stuff that they have around the house. So yes, this research has not been done because that would be crazy, right? It's just, who would do that, right? This is not, we're doing it now, actually. This is the great thing about this. We are now running that experiment. But the problem is, if you look at the actual data, what they've done is that, the really good masks that we can't have, those are very effective. We know this. Worn appropriately in a professional environment, those masks are great. Surgical masks, the next level down, which we also can't have because hospitals need them, which makes total sense, are much less effective, by the way, and they need to be used appropriately. This is one of the key things. But they are proven to be somewhat effective in hospital settings in keeping viruses and other things from spreading. That's the research that's been done. Actually, there hasn't been that much research done on those subjects, but they've been done, and it's pretty categorical, which makes sense. Let's do research on masks. Let's do research in hospital environments where people wear masks and see what happens. So what people have been trying to do is, can we extrapolate from that data and go, how about people in the world? Now, the scientists are not lying about this. If they're creating a model. Let's make some assumptions. And so the assumptions they have to make are like, well, how easily does the disease spread? Okay, we don't know that. Would be great to know that. We don't know that. Are people going to wear the masks appropriately? Let's imagine what kind of mask on average they're wearing. So they're filling in like unknown and unknown, and they're just picking numbers, not in ill will in any way. And then they're going, well, maybe given all of these assumptions, there might be this outcome, which might in fact help, might have a moderating impact on the spread of the virus. Now, that is not crazy. It's also not really, if presented that way, then you have science. If they're saying, look, we have this assumption and the range on this assumption is huge because we don't really know. We have this assumption, the range on this assumption is huge because we don't know. We have this assumption, the range, we don't know. And so our best stab is this. Okay, great, fine. Scientism comes in is when that gets interpreted, as we've been seeing it interpreted, which is you have to wear a mask, or you should wear a mask because it helps prevent the spread of the virus. This is absolutely not a known. It's just not known. And so that's the subtle but important shift of science to scientism, is where a speculative, reasonable attempt to understand a complex and dynamic system gets turned into here we know what's going on and here's the clarity. And it seems to be what the public health officials are doing is they want to do the best thing and they want people to cooperate. And they've decided that the best way to get them to cooperate is to make false claims. This is not also unreasonable because it probably is the best way to get people to cooperate. But that's that subtle shift, right? That's that subtle like, oh, now I'm not worried about what science says. I'm worried about getting people to behave a certain way. And so I'm going to move from reporting what's the best evidence to reporting to presenting data in a way that makes it seem like people should behave in a certain fashion. And that's a really big difference. The example here from our own pandemic, from this pandemic right now, is early on they said surfaces. Surfaces spread the virus. Everybody wash everything all the time. Wash. Okay, great. Perfectly reasonable, right? People touch things. Well, now the CDC has said, well, yeah, it looks like all the evidence, more research has come in. It looks like surfaces don't really spread. You're not going to get it from surfaces. I mean, wash your hands, keep cleaning stuff, but it's really not going to spread it. But notice if you haven't heard that, you can go to the CDC website and see that research. But they don't there hasn't been this effort to get that message out and to say, hey, everybody relax, enjoy yourselves. Don't worry about touching things. It's all okay at the moment. Or, don't go crazy. Don't go licking things, but it's probably going to be okay on that front. So, and because, now they're like, oh, got it wrong. So it was reasonable to wash surfaces. Now they know that it's really not a big deal. It's not that it's unreasonable to wear masks. It's just that it could end up being like surfaces where they go, you know what? It really had almost no or limited impact at all. In fact, the science would suggest it might have impact, but probably not that big. It would be helpful to know, by the way, what the mechanisms of spreading are, because this is still not clearly understood. So that's the kind of shift that you get from science to scientism. Now back to the mortality data, right? This is where it really becomes philosophy dressed up as science, right? Which is what, kind of scientism is. Because here's the question that we have to ask. What is the rate of death we're looking for? This seems like a harsh question, but that's really the question you have to ask. How many people do we want to die? This is the kinds of questions that we make every day in a society. So if you look at the speed limit on freeways, if we reduce that to like 30 or 40 miles an hour, which is what I'm always in favor of, make the speed limits like 30, 35 miles an hour, there would be almost no traffic deaths. That would reduce traffic deaths to an astounding degree. But we've decided that would also be a pain in the ass. And so we don't want to do that. And as a society, we've said, okay, we'll make cars safer, trucks safer. We'll do all kinds of things to try and increase road safety, but we want to maintain a certain speed because efficiency, and this people seem to like to drive that fast, and whatever, for whatever cultural reasons, we've decided that we will accept a certain number of deaths, whatever that is, a couple of, I think 35, 40,000 a year, because we don't want to reduce that speed. But again, if you reduce the speed to like 35, 40 miles an hour, your traffic, I think it'd be like it's extraordinary. The number drops to, not to zero, but to a lot, like 80%. So we could do that, but we've decided not to. This is the same thing with the coronavirus. What is the social cost we're willing to pay, which is the social contract issue, to prevent deaths, and how many deaths are we willing to accept to go on about doing, to returning to a more normal economic, cultural, political activity. Now, this is not a scientific question. This is a policy question, which is to say an ethical, cultural, economic, which in broadest sense, and sense in which I like to think of philosophy, this is a philosophical question. But people do not want to have these things as philosophical debates. So what they want to do is dress them up as technology or research-based or medical-based decisions, science-based decisions, because that carries the stamp of scientific truth. And if I can get scientific truth on my side, we all know you can't argue with that in theory. And so all of these public presentations and decisions are being presented as if they're being guided by the very best available science. And it's not that they aren't consulting the very best available science. It just turns out that in the middle of a pandemic and an ongoing developing situation, the very best available science is not very good at all. And so they're really making philosophical decisions based on the best information they can get. But the best information you can get, you then have to judge. You just have to say, okay, if we have 20 people dying a day from the coronavirus, does that mean that's acceptable? Or is it 100? Or is it 500? Or is it 5,000? Or is it 50,000, right? We know at 50,000, that's too many. We know 20 is would probably be fine with 20. I would guess that wouldn't be a problem at all. We'd go, that's fine. That's, probably lower than it'd be lower than a lot of other things. And, probably the flu runs, I would do the math on that. It's probably less, greater than that. And so you go, where does that comfort level lie? But again, this is a multifaceted decision, almost none of which has to do with science, because we don't have the good science that we want. And so you have philosophical, ethical, political decisions being made and then dressed up, right? Put in this nice shiny wrapper of, this is what the scientists are telling us. This is what the medical professionals are telling us. But these decisions and this research and these assumptions that they're having to run on, in this incredible swamp of unknowns, which is the land of science. Again, I mentioned this in the other earlier lecture, but science tends to research things they don't know. This is what science is about. Science is about doing unknown. We're in a world of massive unknown at the moment, and so this is an opportunity for science, but it doesn't give you good feedback. It takes a long time, takes a lot of careful control, none of which we have at the moment, to get really quality data that would allow you to make, super clear decisions. So when you think about philosophy, this is where philosophy just creeps back in. People try to pretend like they aren't doing philosophy, that they aren't just really making ethical decisions based on political or economic or personal ideas. But that's really what they're doing. This is really the world we're in. If anybody's read Alain de Botton, he does really great stuff, but he has this book called Architecture of Happiness. And in it, he points out that at the turn of the century, this sort of architecture of modernism comes in that says, you make engineering decisions and you make functional decisions, period. And that's what good design is. And we don't have to worry about style anymore. We're not justifying that. We're just doing what's engineering right and what's functionally right. And then you can't argue with me because I'm just doing basically math. I'm just doing science, and you can't argue with that. Of course, this was just nonsense. It was just a cover. It was a way of not having to try and make aesthetic arguments. And I think this is what scientism does. It's a way of saying, if you look just a little underneath the surface, what you're getting is ethical arguments. They're saying, these rates of death are unacceptable, and so we want to try to prevent them, but these rates of death are acceptable. And so then we'll just, revert back to normal. But the people don't want to use that language because what you realize is you're just making a straight up value judgment. And so they say, our medical professionals are giving us the following advice. Often, but the medical professionals, I can't imagine, are saying, this is the right number of deaths. That's not the kind of, advice they're going to be giving. They're going to be saying, we hope that if we do these things, then you'll change the dynamics of the spread and the disease and how people are contracting it in this way. And that will give us an outcome. Now, do you want that outcome? Is that outcome positive? How sure are we of that outcome? We're not sure at all. We don't know what's going on. Like I said, I don't think anybody predicted. I can't find anybody who predicted that the mortality rate would drop, probably looks like by about 50%, by the way. Same thing is true in the world statistics. If you look at it, there seems to be about, been a dramatic increase in number of cases in the world, but the daily death rate, the average weekly death rate, whatever, you can mess with the data all you want. What you find is it's down a lot. I'm just round to 50%, give or take. It's down to about 50% of where it was. And so, but why? Nobody seems to know. I mean, people are speculating, but that wasn't a prediction that I saw people making, or at least I was aware of. May have missed it. But, so these predictions, these are assumptions, these are informed guesses. And then they're presented as fact. That's the switch to scientism. last note on this is people have, over the years, people are always talking about, technocracy. We want an intellectual elite to run the country, but this is why you should always be suspicious, I would argue, of those sorts of cases, because what technocracy wants to do, the technocratic impulse, is to say, okay, we have a model and we have input and we have data and we know the model works and we know the data is good and therefore we know what to do. And if history has shown us anything, is that leads to almost inevitable problems, because you become overconfident. In fact, the system becomes invested in being overconfident. It has to begin to believe, becomes a faith-based system. Scientism is basically a faith-based system where once you've integrated certain assumptions, you have to hold on to those. Even though in the original report or the research or whatever might have given all these caveats and, again, ranges of accuracy and need to do further study. Scientists always say that we need to do further study. Gets interpreted as, oh, this is the truth, right? This is right, and we're just going to hold on to that. And then the system becomes invested in certain beliefs. And then those beliefs get dressed up as if they are true in an absolute certainty science sense. And then actions are made on those. And even when evidence starts to come in that suggests that some of those assumptions may not in fact be accurate, people don't want to change, because the technocratic elite is invested in the belief in the system, because that's where they derive their authority. This is where they derive their capacity and claims to rule. Or to control things. And so this is always why you want to be suspicious of this, of this notion that, oh, there's going to be this magic formula or this particular set of equations or this, economic model or this political model or something that's going to really solve it and make things right, because the evidence and the research and the history of the humanities suggests that the world is very variable, as we're kind of experiencing, hard to get a grasp on it. And that the decisions we have to make are generally like, 90% of the time, 80% of the time, they're ethical decisions. They're decisions based on not complete understanding and full access to perfect knowledge or near perfect knowledge, but rather guesstimates made in real time, which is necessary, based on inadequate knowledge. And so your principles and your values are how you make it. You say, well, which side do I want to err on? Do I want to err on the side of protecting people's lives, or do I want to err on the side of protecting the economy? Hey, let's err on the side of protecting people's lives. See, that's a perfectly reasonable, even laudable perhaps, value judgment. But it's not a scientific judgment. It's not a scientific judgment at all. It's a value judgment. And it's a philosophical, ethical position that says we think these things are more important than those things. Therefore, we're going to make some decisions and we're going to take some actions based on it. And so, as we try to think through this environment, it's important to keep this in mind, that we're almost always in an environment where we have insufficient data. We don't have the research we would like. It's real time and decisions need to be made. And those decisions are not being made based on science. I mean, it would be nice if they were, perhaps, in cases where it's adequate. They're being based on ethics. They're being based on value decisions that influence and have powerful impact on the world. And then you find out over time whether they were good or bad. But generally, by the time you're actually able to determine what would have been the perfect course of action, you've moved on. You got new problems, right? Now we're in a whole new set of disturbing circumstances that we have to address. And so I just think it's important to keep that in mind, that the science is very different from how it's being presented. It's very different from how people are actually making decisions. And as a conclusion to this, I think one of the likely outcomes of this is there may be a general cultural pushback on some of the quote unquote mistakes that they're going to say the scientists make. And I'm always this is the problem of scientism, but it's unhelpful on one hand, and it tends to generate assaults on science, on good, grounded, solid, significant scientific work that needs to be done and that's valuable. And so you're going to see, criticisms of, say, global warming research, because they're going to say, oh, look how, wrong the pandemic research was. And you can, like, I'll be willing to bet money on this, that this is coming. And so, to make this and disambiguate this, I think it's very important to keep in mind what quality real science looks like versus what comes out the other end in public policy and sort of the media discussions of this stuff have almost often zero, but sometimes at the best very low correlations. But most of our decisions, most of our ideas, they're philosophical, value-based, ethical decisions that we make individually, that we make as culture, that our political leaders have to make. They really aren't science-based or scientific decisions. They're value decisions dressed up to look like they have the gloss of science and research, when in fact, they're just value decisions made in real time under difficult circumstances with a vast sea of unknowns. So thank you, and be well out there.